Hey guys, Ashley with Amare. So, few resources for you guys. We are located in Elizabeth and Highland Park, New Jersey, and I also offer virtual consults. So if you guys need my help, give the office a call, 732-841-0142, and our scheduling coordinator can help you get set up with an appointment. We also have our online shop. So all the products that I talk about in my videos, those are all in our online shop for you guys to purchase. On our Instagram, Amare Healing Arts is our Instagram. All the products are linked right there in our bio. Also, the online shop is linked, and it's linked in the description box for each video. So you guys can go and check those out. And then we have our online course school, the Post-Op Academy. So all of the things that you would need to know post-op, we are doing online courses for. So things like what kind of massages you need, when you need to get them, who to get them from, how to find a therapist like me, all of that we have online courses for. There are going to be more courses coming out all the time. So check in on that to see what's new and what you guys can learn. If you like my videos, all of those courses are exclusive content. All those videos are exclusive content. None of them are on YouTube. They're all in our courses. So that is amarehealingarts.teachable.com. The link for that is also in the description box, and it is also linked in our bio on Instagram. So I hope you guys enjoy the content. Ashley with Amare. I will see you soon. Bye.
Hey guys, it's Ashley with Amare. So today we're going to talk about what you need to know before getting lipo, tummy tuck, BBL, breast aug, and other plastic surgeries. I have notes here, which is why I keep looking at my screen, so I can go over everything with you guys. So what is the most important thing to know before you get any plastic surgery? It's taking care of it afterwards. You guys can have the best surgeon on the planet and still wind up fibrotic with complications, with swelling, never seeing your results, with wound healing problems. All of that is because of the way you're taking care of it, right? So if we go out and we buy a Mercedes and we are never getting maintenance done on it, never getting it washed, never changing the tires, never taking care of it, it's not going to last very long and it's not going to ride very good. So it's the same thing with your surgery. It's how you're taking care of it after surgery that matters the most. So what is the most important thing? Number one that we need to know before getting plastic surgery is we need to know about the aftercare. And there is a lot of aftercare, trust me. So I am a certified manual lymphatic drainage therapist, certified compression garment fitter, lymphedema therapist, certified lymphedema therapist, licensed massage therapist, plastic surgery recovery specialist. This is all I do. I specialize in how the body is supposed to heal from swelling events, from injuries, from plastic surgery, from all of these things. So when we're talking about things that you need to know, how do you guys find out what you need to know? Well, you're watching me on YouTube, you're watching me on TikTok, you're watching me on Instagram. You found me somehow, right? You Googled and you found something. Second most important thing, like super, super important, where you are getting your information from about your recovery. So things you need to know before, right? Your doctor gives you like this pre-op paperwork and he's like, all right, go get a blood test. All right, go get an EKG. Okay, are you on any meds? All right, you're cleared for surgery. Cool, see you the day before. They do your markings. They're like, all right, don't eat. You know, you have your strict protocols. Use the antibacterial soap right before, all these things. Then you go in, day of surgery. You get the surgery. You come home. There's nothing to do before the surgery for the actual surgery. Everything that you're supposed to be doing before your surgery and everything you need to know is all about your post-op care. It's all about healing afterwards and taking care of it, because let's say it's something like lipo and it's minimal. That's 6 to 8 weeks. That's 2 months that you're going to have different phases of healing, and your body's going to need different things for each phase that you're supposed to be doing to heal. So when you guys are doing your research, that's not what you see. What you see is, oh, check out this roller, it's real great. Or, oh, this spa made me so snatched. Or, oh my God, I have fibrosis. Or, oh my God, I had this complication. Or, okay, I got my massages and they were so beyond painful, but oh my God, I look so good. Guys, that's not research. That's looking at other people's journeys. That's looking at what other people are doing, but none of that is backed by research or science. None of that is backed by somebody who's certified, telling you what to do to make sure you heal properly, explaining the healing process. That's not research. I'm gonna say it again. Watching people's My Journey videos, watching TikTok reels and Instagram reels that are not by people who are specialists or certified, that is not research, even watching, like, let's say you do find a video about your surgery, right, from a surgeon, and they're showing you how the lipo's done. That's great, right? That's at least something, but that's not going to help you to heal. You guys think surgery is just the surgery day and then, oh, it's whatever. No, if you get a tattoo, the getting the tattoo part itself is not what makes the tattoo perfect. It's the healing time, making sure the lines don't blow out, making sure you're covering it, making sure there's different stages. So when you get a tattoo, right, you get the actual line work done, right? You get the tattoo. Then they put like some sort of protective covering on it, right? You leave it for 48 hours. Then you take it off, you wash it with mild soap, and then you put ointment on it. And for the next like 4 weeks, you're putting ointment on it, checking the scab, making sure it's healing properly, making sure it's not healing thick, making sure it's not peeling. You're doing the aftercare for it. When you buy a car, let's say you buy a Mercedes, right? You don't just go into the dealership, buy the car, and then drive it around and that's it. No, you got to do maintenance. You got to get tires. You got to get your oil changed. You got to clean it. You got to do all these things to make sure that it stays running and upkeep it, right? Your surgery is the same thing. You guys are having at least 6 weeks where you should be doing aftercare, like active game plan of action, post-op care. So this is what you need to know before surgery is it's not just about the surgery. It's about the aftercare. You guys need to be doing post-op care. And I'm not just talking about your massages. I'm talking about your research. I'm talking about understanding and setting up that game plan so that you don't have complications. You don't have fibrosis. You don't have seromas. You don't wind up with garment burn. Your incisions don't have so much swelling behind them that they keep popping open. You don't have any of those things, because you did the research to understand all the phases of wound healing and how you're supposed to heal through this surgery. So before we get into this, I'm just going to pause real quick. We have an online course, Post-Op Lymphatic Massage and Finding a Therapist. The first module talks about after surgery, your swelling. What is it? Why is it there? How did it get there? Like explaining the swelling after surgery and the phases of wound healing and what your body's going to go through. Module 2 talks about your lymphatic system and how it's responsible for getting rid of swelling. In there, we also talk about compression garments. And then module 3, we're talking about manual lymphatic drainage, which is your massages to get rid of your swelling that you're going to need for 6 to 8 weeks. Those first 6 to 8 weeks after surgery, if not longer, depending on the surgery you have, you're going to need manual lymphatic drainage massages. But everybody knows that, right? So that's like, okay, yeah, we know that. Tell me something new. Manual lymphatic drainage is this. It's extremely gentle. It is a skin pumping motion to get your body to reabsorb fluid. There's a specific sequence and specific areas that are supposed to be worked first to dilate the lymph vessels to get your body to reabsorb the swelling and pee it out. It's not just a rub. It's not just, okay, I'm going to put oil on your stomach and rub you. There's a whole science to it. So I explained to you guys how that works, how your body pees out the swelling, because it's not just about the massages. There are things in your diet, which we talk about in all the modules throughout the course. There are things in your diet that will cause your body to hold on to swelling and harden it into fibrosis. There are things you need to be doing during surgery and keeping a check on at home to make sure your body's healing properly and that you're not getting in the way of your healing. Because little freebie tip here, drinking Gatorade will cause fibrosis, and you'll learn why in the course. But it's really important that you guys don't do these things that cause more problems during your healing. And you don't even know they're causing problems because you think, oh, I did my research. I went on Instagram. I did my journey videos. I saw how the whole surgery thing goes. So I'm going to have Gatorade and I'm going to have electrolytes and I'm going to have pineapple juice and I'm going to have all these things. Guys, all of that is just someone showing you what they did during their surgery. That is not explaining to you why you need the thing itself. That is not explaining to you, okay, I did this because it does this to my body, which helps with this part of healing. That's what our course does. The research that you're doing, the YouTube, the My Journey, TikTok, Real Self things, is just people trying to get through their healing like you are, throwing things at the wall, hoping that it sticks, but not understanding the physiological effect it has on your body while healing. And then they're like, oh, well, I had fibrosis, so I used a roller and I got squeeze massage and it was so painful, but now I don't have fibrosis. but I'm swollen and it's 8 months and I'm still in my garment. Guys, that's no way to heal, like at all. So this is why your research is important. That course, so module 4, I talked to you guys about what your module 3 and 4, I talked to you guys about lymphatic drainage and what it's supposed to be during your sessions. And I talked to you about when you should start, how to know when you don't need them anymore, what they should feel like, how the sequence should go in the room, what the therapist should be doing with their hands, how to know that they're doing it right and it's not just a regular massage, how to know that your therapist is like certified, licensed to do this and knows what they're doing. All of that is modules 3, 4, and 5. And then module 6, I talk about your supplies. So I debunk the whole like using ice versus using heat, the roller situation, the board situation, and I give you guys the basic supplies that you need for any surgery. So you know what you have as like a baseline to like start with, and then if you're having a BBL, obviously you need a BBL pillow or things like that. But then that's the bonus module. So that's our course. Now when we're talking about research, guys, that's a place to do research, okay? Getting an actual plastic surgery recovery specialist like me doing pre-ops so we can set up a plan of action, or doing post-ops so I can help you if you're having complications in whatever you're doing. That's actual research. Watching my videos where it's all supported facts, science, that's research. But please, TikTok, Instagram, my reel, my journey, people just sharing their things like the Facebook groups and all of that, you guys need to start asking better questions. Because you're not asking any questions. You're going into Google, you're typing in like how to heal after lipo and finding somebody's blog. But you don't ever check the credentials of that person to see if they're even a licensed person to be telling you about this. So it's all about your recovery afterwards, right? So when we're talking about doing that research, what are we looking for? We're looking for what we need to recover afterwards. Because you go in the day of surgery, doctor gives you all the pre-op stuff, you show up to the surgery's done, and then what? Then nothing. Then it's your responsibility to heal, and you have to actually make sure you're checking on it. You guys think that your doctor is going to just hold your hand through the whole thing, and you don't have to worry about anything, or think about how your body's feeling, or think about how your body's healing, and just, doctor said wear the garment, I'm just gonna wear the garment, not even gonna look at it. I'm gonna eat what I want, I'm gonna do what I want. The doctor will tell me when there's a problem, and we'll fix it then. You need to be proactive because it's about your recovery. So when you're doing research before surgery and you're like, all right, I'm thinking about doing surgery. What do I need to know? You need to look into the aftercare. You need to start looking at garments. You need to start looking at post-op supplies. You need to start learning about manual lymphatic drainage massage. You need to start finding someone in your area. You need to start doing research on how your body's supposed to heal. It's all about your post-op care. I cannot say this enough. Preparing for surgery, what you need to know before lipo or BBL. Yes, obviously. And I have tons of videos, guys, on my YouTube. And some reels on Instagram, but all the reels are just basically parts of the YouTube videos. All of the surgeries that I talk about, like breast aug, tummy tuck, BBL, lipo, I have videos explaining every single procedure. Air sculpt, tri-sculpt, Vaser lipo, BBL, skinny BBL. If you guys don't know anything about the surgery and you're interested and you're like, all right, well, let me see what this actually is, I explain to you everything about the surgery, how it's done, and how you're supposed to heal afterwards. So go to our YouTube, type in, whatever you're looking for as far as surgery, and you'll find those videos. That's a place to do research. That's the first step. And then once you've decided you're going to do it, and guys, usually you guys don't even think about doing research until you've already had the surgery, or until you're like a week before and you've like put a down payment and you're like ready to have the surgery, and then you're like, oh, I should probably figure this out, right? Like my doctor didn't tell me that I wasn't gonna have a garment, and now it's a week before and he's telling me I'm not gonna have a garment, and I don't know what I'm doing and I'm scrambling. So that's usually when you guys find it. But that's part of the issue, is you guys only look at like the garment itself. You don't ever ask why you need the garment, what it's for, what it does, how it's supposed to fit, how it's supposed to function. You just go, garment for liposuction. And then you see all these people with these videos where they're like, this garment has a belt, this garment has a this garment has a that, this one has zippers, this one has a crotch in the back. But you don't ever ask why. Like, why do we even need this? Why do we need massages? Why do we need supplies? Why do we need a garment? Why do we need foams? Why? So you guys got to start asking better questions about your recovery. When you, and this is the best way to do it, and this is how I created my course. When you guys think about an aspect of recovery, so let's take massages. You go, okay, post-op massage. And then you find something like body contouring, and then you see a video, and then you assume that's the massages you need post-op. You don't actually ask why you need massages for post-op. And then when you ask why, it says for swelling. And then you're like, okay, well, what massages do I need? Lymphatic drainage. All right, so then I'll go look up manual lymphatic drainage, and I'll see all this conflicting information. Guys, it wouldn't be conflicting, and you would know how to discern between what's real and what's not if you knew why you were even looking for that thing in the first place. Because it's supposed to be a gentle massage to help you pee out the swelling. Well, you need massages for the swelling. So if it's not a gentle massage, you're not going to pee out the swelling. Okay, but why? Why is that? Because of the lymphatic system. Okay, well, what is the lymphatic system? Lymphatic system is your body's way of reabsorbing swelling. Okay, well, what is it? How does it function? It's a hair deep and a hair thick beneath your skin, and it's little vessels that dilate and pump when your skin moves. Oh, so that's why it has to be a light pressure massage, because if we're going past the skin, rubbing at tissue and bone, we're not going to dilate those vessels, and I'm not going to reabsorb the swelling or the proteins that cause fibrosis, and I'm not going to pee it out. I'm just going to be digging into tissue. Oh, okay, now I got it. When I started making the course, guys, I started with the Vetting Your Therapist guide, because in my virtuals, you guys were always like, help me find a therapist, help me find a therapist, help me find a therapist. You know so much, find me a therapist. And I'm like, okay. So I would call and I'd be like, hey, you guys offer MLD. I just wanted to make sure it's the real thing. What are you doing with your hands? Like, how does the massage go? And they're like, oh yeah, we're using oil and we're rubbing and this and that. And I'm like, well, that's not MLD. Okay. And then I'd call a bunch more places and eventually find someone. But I was like, okay, this works. The client goes in, and then they're still rubbing her with machines and things, which they didn't tell me over the phone. Guys, there's only so much I can do. So you have to advocate for yourselves. You have to learn how to do your research. You have to learn what this massage is supposed to be. I can't go with you. Unless you're in Jersey, I can't be your massage therapist. So I need to teach you what is supposed to be happening so you can find somebody that knows what's supposed to be happening and what they're supposed to be doing. So I started the Vetting Your Therapist guide with those questions on there, the questions that I would use to call when I was vetting a therapist for you guys. And I was like, wait a second. But if you don't understand how manual lymphatic drainage massage is supposed to go, you're not going to understand why to ask these questions. So then I built out module 4, and I was like, well, wait a second. If you don't know how the lymphatic system works, how are you supposed to know how manual lymphatic drainage works? So then I built out module 2, and I was like, well, wait a second. If you don't even know why you have swelling to begin with, you're not going to understand why you need your massages or the lymphatic system. So then I built out module 1. And then I was like, all right, now we got to go over like the training that I have that someone that's doing your massages is supposed to have. Because you guys don't need, like, your lymphatic massage therapist does not need to be a plastic surgery recovery specialist. You have me. You found me. You can schedule a virtual with me. You can take the course. You can come in person if you're in Jersey. Yes, having someone like me to build out your post-op care for you and tell you your instructions and tell you what to do on what day at what time based on your healing process and cover all your bases. So I do all the research for you and then you guys just follow the protocol. Yeah, you need that. Especially if you're having something like a mommy makeover where it's breast aug, tummy tuck, lipo, and fat transfer to the hips. Like if you're having something major, yes, you need that. But the role of your therapist is just to get the swelling out. The role of a plastic surgery recovery specialist is to help you specialize for your recovery. So then I built out module 5 and I was like, all right, so this is what the person who's going to do the swelling thing needs to do for you. And this is what they're supposed to know how to do. And here's the things that you ask so that they know, so that you know that they're like actually going to do the thing that gets the swelling out. And then I was like, all right, well, since we're talking about all this post-op stuff, and I've mentioned garments, and I've mentioned diet, and I've mentioned fibrosis, and the foams and how to get rid of it, we're going to do a bonus module and talk about all the myths, like the ice and the heat and the machines and all of these things, and when you should be getting them done and when you shouldn't be getting them done. All of that is in the course. That's the research I'm talking about, guys. Not just learning one word and then assuming that's what you need. So that course is in our, just side note, that course is in our post-op shop, Amare post-op shop. It's also linked in the description box and linked in our bio on Instagram if you want to go purchase that and start with your research. But that's what you need to know before surgery, is about your garments, about your supplies, about your massages, and about finding your therapist. It's building your aftercare team, basically. So having a specialist like me, and then having your therapist, and having your supplies, and having a protocol, and having like dietary changes, and making sure that you're doing enough, and not doing things that are going to cause fibrosis. So this is the next thing, right? Learning about your phases of wound healing, learning about the phases of healing of how your lipo is supposed to heal. Okay, so there's 4 phases of wound healing. There's homeostasis, which is the initial bleeding after the cut. Then there is the inflammation phase, which is where you get all that swelling. Then there's the proliferation, where it starts to make solid tissue. So let's just describe the proliferation phase as when you get a fat transfer and the fat starts to become permanent. That's proliferation phase. And then maturation phase is like that 6, 12, and 24 month mark, where it's becoming permanent tissue. When we're talking about these phases, guys, they're not always like linear. They overlap. They're not like one starts and the other ends. They overlap. So you'll have inflammation and homeostasis at the same time. You'll have inflammation and proliferation at the same time. You'll have proliferation and maturation at the same time. This is why it's important to understand what your body's going through, because you can tell what phase you're in based on your swelling. You can tell how your body is healing based on what's going on with your swelling, because swelling is the thing that makes the new tissue. So that's why it's really important to understand how swelling works in the body. But knowing how your body's feeling, how it's supposed to feel, what your swelling's supposed to feel like, lets you know, because you guys will look up fibrosis or seroma and still not have any idea what it is. And the minute you feel anything, you're like, oh my God, I have fibrosis. Oh my God, my surgery's ruined. I'm going to die. No. Fibrosis is not a death sentence. I have a whole video on fibrosis where I explain it and talk about the modules, several in the course, where I talk about fibrosis and teach you guys how to like get rid of it and how to handle it and how to prevent it. Fibrosis is not a normal part of healing. Fibrosis is a swelling complication. It's a complication that's happening to your swelling. Seroma is a pocket of fluid, a pocket of swelling. That is also a complication during healing. When you guys are doing your research, to know before, like liposuction, right? Because in order to have a BBL, we got to have lipo. So lipo BBL or just plain lipo. There is always going to be a potential for a fibrosis if you have swelling and you are not taking care of your swelling properly. If your swelling is starting to get thick and stagnant and hard, that is turning into fibrosis, it's because you're not doing something in your recovery right. So when you're doing your research about what do I need to know, when you're looking at complications, you need to understand how the complication got there. Then we need to reverse engineer it. So like fibrosis, right? Fibrosis is a hardening, lumps and bumps forming of scar tissue, inflammatory process in the body. Okay, fibrosis is an inflammatory process, inflammation phase, swelling. Fibrosis starts as swelling. Okay, so in order to prevent fibrosis and to prepare for preventing fibrosis, I need to take a look at my swelling. Okay, so I need to learn how to take care of my swelling properly. Okay, so I'm going to go rewatch module 1, 2, and 3 and understand why swelling is there, how we don't make it worse, and how we get rid of it so I can avoid fibrosis. That's how you guys got to be looking at this stuff. Is you got to start reverse engineering it and asking better questions. Don't just settle for what you see online. Make sure you're digging down the rabbit hole to understand this stuff, because none of this is exclusive to plastic surgery, guys. Stitch, incision healing, that can happen with any surgery. If I cut my hand open, I'm going to have stitches. I got to take care of them and monitor them the same way. Fibrosis will happen anywhere you have swelling, after cancer, with RA, with fibromyalgia, with knee surgeries. Even I have a client right now who tore a tendon and a ligament in his knee, and he has fibrosis starting to build up because it's been 4 months. He hasn't walked or used his knee at all, and that swelling in the knee started to pool. Didn't have surgery, but has fibrosis from the swelling. Guys, none of this stuff is exclusive to plastic surgery. This is all medical body things. You can find the same way I find medical journals on all of this stuff to understand it. Now I understand the reason you're watching my videos is because you guys don't speak medical journal. You guys don't speak surgeon. You don't know what any of this means. I do the research for you. I created the course to do the research for you, to give you everything you need to know before having these procedures. Let's say you're doing a breast augmentation, right? So you're doing a lift and you're getting implants. Complication with that is having that little opening, right? Wound dehiscence is where it starts to open. So we got to look at, okay, what causes that? Infection, swelling, garments that are cutting into you, stitches that wind up needing to be taken out, lots of different things. Okay, so we look at each one of those things and we go, why does this happen? And we look at why it happens and we go, okay, well, if this is why it happens, then I need to do the opposite. So I'm going to look at how to make sure I'm doing the opposite. So like with the garment, cutting into it and busting it open because it's trapping swelling, right? All right, so then I need to look at garments for after breast aug and why we need them and what they're supposed to be like and how it's supposed to fit and how this whole thing works so I can prevent wound dehiscence. That's how we got to start looking at this stuff. So those complications, that's what we got to do. Swelling. Guys, your swelling does not need to last months. It doesn't need to last 6 to 8 months. It doesn't need to last a year. It doesn't need to last 3 months. You can get rid of your swelling as quickly as 6 weeks. You could be healed and done in 6 weeks as far as your swelling goes. And then obviously your tissue's still healing. But swelling doesn't need to last months and months and months and months. Your surgeon will tell you at 6 weeks, oh yeah, you're still swollen, give it some time. Your surgeon will tell you at a month and a half, 6 weeks, or then 3 weeks or 6 months, oh yeah, you're still swollen, it's gonna take some time. Guys, no, it's not. It doesn't need to. Is it going to take time if you don't do anything about it? Yes. Is it going to stay there? I just posted a picture today of our lovely little angel who came to, when she first called, she was like, I don't know if this is going to work, but I'm just trying everything at this point. So when I first saw her, she had so much going on. But she's 10 years out from lipo, 10 years out from 2 facelifts. So a regular, just the skin, and then a deep plane where they do the muscles. And I'm going to do a video on deep plane versus regular facelifts so that you guys know what the difference is. But she's 10 years out, right? So she comes to me for her abdomen and she was bloated, right? She was swollen. So that's what she came to me for, not, for post-op. So we were working on that and I was looking at her face. And she starts telling me about that because I saw the scars and I was like, oh, you had a facelift? Okay. So she starts telling me how it was 10 years ago. She never did any post-op care. It was swollen and then it just healed like that and it never got any better. And I was like, let's try an MLD face session, like a head, neck, and face session. Because swelling, when it heals in the body, it gets trapped and then it doesn't move. It can go away. And if you guys don't believe me, check out the before and after I just posted because she's 10 years post-op. We didn't get her back in a garment. Her swelling and everything is healed. And that first picture is how she looked for the past 10 years. After an hour with me, she looks completely different. She looks completely different. So check that out. It's on our Instagram. But guys, that swelling will stay in there and heal in there forever. And then you guys say the lipo didn't work or the surgery didn't work or you're just like, oh, okay, well, this looks better than before, so this is what it is. No, it's not. No, we can get rid of it. We don't need it to be like that. So the thing is, you guys go and get your massages. And the massages you get that are supposed to be lymphatic massage are oil rubbing or machines or incisional drainage where they're squeezing blood and fluid out of you or really deep pressure or just like this, which is not lymphatic massage. I don't know what that is, but that's not lymphatic massage either. Or using body contouring and things like that. If you are not dilating the lymph vessels properly, you will not see a reduction in swelling. Sure, it may feel good, but you won't see a reduction in swelling at all. And that's where the problem comes in a lot of times is because you guys say that you get your massages and you're like, oh, well, I got my massages and this is how I healed and it's just whatever. No, those massages were not the right thing. They weren't actual manual lymphatic drainage massages. So that's another part of it, is that it gets stagnant and it sticks in there and it stays in there. And you say you do your massages, but you never really understood what those massages were supposed to be. You just found some place that did lymphatic massage and assumed that it was correct, and then just healed with all the swelling trapped in there, and then settled. You guys settled for those results because your surgeon was like, oh, it's fine. Oh, it's fine. Oh, you're fine. Oh, you're good. Oh, you're fine. Yeah, you're healed. You're done. And you don't want to go through surgery again. So you're just like, all right. Well, I guess this is it. I guess this is what I look like. Okay, well, it's better than it was before, so I guess I'm fine. But it's not. You don't have to heal like that. Now, the easiest way to paint this picture is when you guys have scars that are raised. That's swelling, still trapped in the body. When your scars are starting to heal, really lumpy and bumpy, that's a sign that one, the massages you're getting are not getting rid of your swelling properly, because that should be flushed out from underneath the skin. It shouldn't be healing like that. Two, why would you wait until the wound, which we can make sure doesn't heal with swelling in it, why would you wait until that wound heals and becomes a scar and becomes thick and lumpy and bumpy and almost permanent tissue, and then start doing aggressive, deep rubbing scar massage to flatten it? Why would you do that? Why wouldn't we just take care of the swelling while it's still a wound to make sure that it doesn't heal with swelling around it or in it or by it or anything like that? Once your scab falls off, right, and the skin starts to heal, why wouldn't we be doing actual manual lymphatic drainage massages to the surrounding area of the skin and make sure that it doesn't heal lumpy and bumpy? Why wouldn't we do that first? Because you didn't know. And this is why I'm doing this video. So that's another thing that I get asked, is the whole scar situation and fibrosis situation and wound healing situation. Like, what do I need to know about scarring before plastic surgery? It doesn't ever need to heal raised. And if it is, that is an indicator that you're not taking care of your swelling properly. Guys, swelling after surgery is meant to be taken care of. Swelling anywhere, ever in the body, for any reason, is meant to be taken care of. It's there to bring proteins and water and cells to the broken tissue to heal it, but it's meant to be used to heal. So if it's sitting there stagnant, it's not being used properly. If it's getting thick and sticky and tough and lumpy and bumpy, it's not getting used properly and you're not healing properly. And that swelling that then turns into that hard lumpy fibrosis slows down healing, stops healing, causes you to be numb, causes your skin to like be discolored. One of the really good indications that you guys are starting to develop fibrosis or that you have a lot of stagnant swelling is when your skin is really tough, or just not tough, but like heavy, like Play-Doh-y or like gel-like under your tissue. It's not just watery swelling. And then you do like this, and it's like red line and then white immediately after. You're having loss of circulation or impaired circulation because of the amount of swelling. There's something called diffusion distance, which is the distance that it takes for oxygen and nutrients to get to the tissue from your bloodstream. That distance will be increased by swelling, and it'll take longer for blood and oxygen and nutrients to get to your tissues, and it will make you heal a lot slower. It's the same, now an exaggerated, way exaggerated version of that. It can go from something as little as swelling, which is causing your skin to have that like circulation issue, or all the way to necrosis. So I'm going to do a video on necrosis, but necrosis talking about complications and swelling. Necrosis happens when it's tissue death, necrosis, that's what it is, skin or tissue death, and it becomes like black and everything like that. But that happens when there's no oxygen, blood, and nutrients to the area and the tissue starts to die. That can happen if you're wearing a garment that's too tight. It will cause necrosis to a wound, to your swelling, to your tissue, to a fat transfer, to anywhere. When we're cutting off blood and circulation, we're then going to feel the numbness, we're then going to feel the tingling, we're then going to see the discoloration. And I'm not talking about with a garment, I'm talking about with your swelling. When your swelling gets that bad, think about when you, like if you crisscross your legs and sit on them, and you get pins and needles, then you look at your feet and you see that they're like white or like turning colors, right? That's from the pressure from you sitting on them. The pressure from the swelling inside of your body can do the same thing. It can cause that numbness that you guys feel just from the swelling because it's so much. It can cause the tingling. It can cause the circulation issue that you've going on. So swelling should not be kept in the body. We should be doing things proactively to make sure that we're getting rid of the swelling, that the swelling's coming off of us, that we're actually taking care of and working with and keeping our swelling flowing out of the body. So swelling flows in to that interstitial space after the cut. We want to make sure that we're getting our swelling to stay as liquid as possible and flowing out of us and peeing it out of us and getting it off of us, and that it's being used properly in our body and not just sitting there stagnant to become a wasteland and then become fibrosis. So how do we do that? Your massages. Now, I've talked about your massages already, but when you guys are doing research on your massages, please stop looking up post-op massage, because post-op massage is an umbrella term for a bunch of different massage modalities. Post-op massage is not one type of massage. Post-op massage is an umbrella under which cupping, body contouring, cavitation, wood therapy, RF, ultrasound, squeeze massage, like you will find so many things if you type in post-op massage. Please stop typing in post-op massage. You do not need post-op massage. You have swelling that needs to be taken care of because swelling helps you heal. Swelling is how you heal, by the way. You need manual lymphatic drainage massages. So type in manual lymphatic drainage massage because you're going to get a way different result on Google when you type in post-op massage near me versus lymphatic drainage massage near me. Very different. And you want somebody who is a certified, licensed manual lymphatic drainage therapist, who works with swelling, who understands the anatomy of the body, who understands this very intricate map of your lymphatic system and how it's supposed to work and where we need to work in which order to be able to get all of this swelling to reabsorb back into your body so you pee it out. Guys, this is a science. Your massages is a science. It's not just rub me with oil. It's a technical thing. It's super technical, which is why I love what I do. Because I know how to work that map and I know how to work your lymphatics to get amazing reduction in swelling, but also get your body to process all that stuff. The reason you guys can't just squeeze swelling out of your body and then it be like, oh, okay, I'm healed, is because your body actually needs the things that are in your swelling. So when we're doing lymphatic drainage, your body is reabsorbing all that stuff. It's going through you into your bloodstream and then you're peeing it out. So it's not just bypassing. It's going through everything. It's taking away all the broken tissue. It's helping to heal your tissue itself, and then you're peeing it out. So we're working with the swelling to speed up the process, not bypassing it just to get the swelling off of you. That's what I need you guys to understand. You need your massages to work for your swelling reduction, but it's also working to help heal your body. It's not just get the swelling off of me, contour and shape me. Guys, your massages are not meant to contour or shape your body. We're not sculpting. You had the surgery. You've already been cut. When surgeons take that video or that picture when you're on the table, those are your results. Right there. Surgery's done. That's what you look like. But that's not your final result. That's what you look like underneath all the swelling. So that body, that like immediate post-op body right before you start swelling, when you get out of the operating room, that body is being hidden underneath all your swelling because your swelling is trying to heal that body to make it permanent. So what we need to do is not dig into our swelling and dig at that tissue that's trying to heal that way. We need to uncover it by getting the layers of swelling off with your massages. Uncover that body that's under there that we just paid for. Not try to take your swollen body and sculpt it into that thing. That's not how it works. You already had the surgery. You already had the sculpting. So it's not about shaping you or sculpting you or like smoothing or contouring you out. You've already been contoured. We need to get the swelling off of you to get to your results that are hiding underneath. Just like that before and after that I posted on my Instagram. Her results are under there. They're under there. Her facelift results. And you can see them start to come through in the photo. But they're not, it's not like I sculpted and contoured her face. You want to know what I did? I did this. This is what I did to her face. In a very specific pattern, in a very specific way, for 45 minutes, rerouting the swelling out of her face to get it to reabsorb and to get it off of that top layer to see her results underneath. That's what you're doing with your massages. Your massages are meant to get the swelling off of you, not contour you, not shape you, not sculpt you, not any of that stuff. So now that brings me to your supplies, right? The next and final thing you need to know before getting your surgery. All these topics. Your supplies. I just did a video last week on your supplies about the things that you don't need and the things that you do need, like what you actually need for surgery. Not all this gimmicky stuff that's out there. Not all this crazy stuff where everybody's telling you to buy this, that, and the other. But here's a thing. Here's why it works scientifically. Here's when you use it in your healing process. And here's how you use it. Your supplies, you need very little. I want you guys to think about when you get stitches on your hand, right? Let's say I cut my hand open with a knife. I get stitches. We wrap it with something, keep it covered, right? We put an ointment on it, right? If we're really, if we're doing the best for it, we're doing a little bit of manual lymphatic drainage, not anywhere near the cut, but on the tissue on the other side around it. So let's say, and this is for surgery in general, right? Let's say this line right here is a cut. I'm not going to do manual lymphatic drainage and move the skin of the incision. I'm going to come down here and I'm going to do this. And I'm going to move the skin in the surrounding area without ever touching the incision, without ever pulling on the incision, without ever stretching the skin of the incision. But by moving all of this surrounding tissue, it's going to suction all the swelling out from that area. So stitches, right? We wrap it, we bandage it with like a gauze or something. We have an ointment for it. We have a soap for it. We're doing the manual lymphatic drainage, especially because it's my hand. I'm moving it a lot. It's going to swell, right? So we're doing the manual lymphatic drainage to make sure all the swelling is away from here so that it heals flat and doesn't scar. Because if your skin is billowed out like this, it's going to heal billowed out. When we get that pressure down, the seams come together and it heals perfectly flat and seamless because the tissue is now laying flat. So that's the other point of manual lymphatic drainage. But we've got our supplies, right? So soap, we've got ointment to put on it to make sure that it heals properly. We've got compression. We've got like a wrap, right? We're doing manual lymphatic drainage to get the swelling down so it heals flat and so that swelling doesn't bind up in between my tendons and try to make itself into scar tissue. So we lymphatically drain to make sure we're getting all of that out, right? And then we're using some sort of anti-inflammatory. So the postop extra strength arnica cream that we have for the rest of the hand and all the swelling everywhere else to help take down the pain, or taking Tylenol, whatever we're doing, right? It's the same thing for your surgery, guys. You don't need much. You're overdoing it. And I have a whole 45-minute video on it. You guys can go listen to my whole speech about how much you're overdoing it with your supplies. But when you're doing research on your supplies, here's what I want you to know. Here's the important part. For lipo, you need lipofoams to cover every single inch of skin that you had liposuction. If you only had lipo to your stomach, you still need to cover your sides because of this lymphatic mat. If you had lipo 360, you need foam covering every single inch of your skin that had lipo. If you had lipo of your thighs, you need lipo foams in your garment for your thighs. I talk about the lipo foams in the product video if you don't know why you need them. You need garments for all of these surgeries, lipo, BBL, tummy tuck, breast aug, and everything else. You need to do your research on your garments. You need to find out if your surgeon's giving you a garment. If not, you need to find a garment for your surgery. And if you don't know what that is, how it's supposed to fit, what it's supposed to be like, set up a virtual with me or come into the office in New Jersey. You need BBL Pillow. I have about 5 videos on how to sleep, sit, rest, positions to sit in, positions to sleep in for your BBL Pillow, and why like what kind of BBL pillow you need, because not all BBL pillows are the same. And not all lipofoams are the same. So I have videos on all of those on the product page for each product on our post-op shop. For tummy tuck supplies, garment, foams. It's pretty much it. And then the basic, you know, soap, wound care, post-op, extra strength, arnica cream. Breast dog, garment, foams, depending on if you have implants or fat transfer or not. That's going to be a little bit different. But any surgery, your supplies, anytime you see something. Because again, I want to start training you guys, and this is the point of the course, training you how to think. I can't answer every single DM. I can't answer every single question. It's impossible. You guys have a million questions specific to your surgery, and I don't even know what your surgery is, and you're sending me naked pictures of yourself in my DMs, and I'm like, you need to set up a virtual. I can't answer all these questions for you. I have no idea what the backstory is here. And then you're sending me paragraphs, and I'm like, that still doesn't give me anything. I need to talk to you. So I want to start teaching you guys how to think about these things, and that's the point of this video. When you're looking at supplies, if you see something like a BBL mattress, I want you to stop and think for a second. All right, I had a BBL, which is fat transfer on my glutes. They took the fat from somewhere. They took it from my back, my sides, and my stomach. So my butt's going to go in this hole, but then my back, my sides, and my stomach are going to sit on this basic, like, blow up plastic mattress thing. Is that really going to be comfortable? And then even still, looking at that hole, there's going to be pressure on my back where I had lipo. There's going to be pressure on my hips where I have the fat transfer. Yeah, it might not be such a good idea. And this is why Ashley with Amare doesn't recommend it. So I'm going to go watch her video on how to sleep and lay and sit with a BBL. That's how we got to start thinking about things. If we see a board, all right, why do we need a board? To get you flat. Well, getting me flat means getting rid of my swelling. How does a board get rid of swelling? It doesn't. It's just a piece of cardboard wrapped in fabric. That's literally all a board is, or a piece of sponge wrapped in fabric. All right. Well, does that help me get rid of my swelling? No. All right, but foams, the Amare polyurethane medical grade foams, actually produce a microstimulation to the lymphatic system, constantly 24/7 stimulating my lymphatic system to make sure my fluid stays as liquid as possible so I can pee it out, and helping with moderating my compression garment so it's not too tight or too loose, and protecting me from garment burn. Okay, so do I really need a board? Well, I'm having a tummy tuck, and the board is supposed to be for abdominal support. All right, well, if that's why we're using it, then yeah, we're going to put it over the foam just to give you some abdominal support. But that's what we're using it for. We're not putting it directly on our skin to try and smush the living daylights out of our swelling to get snatched. Because that's not how that works. That's how you create fibrosis. Sure, you may look tight and tiny, but you're tight to the point where your ribs don't move and you can't breathe and you're in pain. That's not how we go about the supplies things, guys. We need to start asking better questions. And you guys see these people shoving these boards into their garment and pulling their garment as tight as humanly possible and saying that they're getting snatched, but you don't know what they feel like. You don't know what their skin feels like. And if they're 3 months, 6 months, 8 months out, still wearing a board and foams 24/7, still having problems with their swelling and fibrosis, is that really someone you want to be listening to? Are they really doing the best? Are they really explaining to you the science behind what they're doing and why they're doing it and how it's helping? Not just, oh yeah, I tried this, it feels better, it helps. We don't want to be going about our supplies like that. If we're looking at a supply of some sort, whatever it is, if we're looking at a BBL pillow, we got to look at why we need it, what we need to get from it, what it's supposed to do for us, how we're supposed to use it, and then decide if that's what we need. Because there's a lot of things out there, guys. There's like sponge and memory foam, and none of them are machine washable, and it's really gross. But I digress. There are a lot of things. I just want you guys to start looking at your supplies and being like, do I really need this? Like, do I really need this? Like, yeah, people are using it, but does it really serve a purpose for my surgery, for my body, for my phases of wound healing? Do I really need it? And guys, if you ask your surgeon, they're going to tell you, you can. It's fine. They don't really know, guys. They're not the ones doing all the recovery. I am. And I got tons of videos on this stuff anyway, if you want to like go look at them with the supplies. But you need to do less of the, and this is, you know, to wrap it up. I'm not wearing a bow today. Usually, oh, wait. To wrap it up in a nice little bow. What do you need to know before getting your lipo, your plastic surgery, your BBL, your breast aug, all of that? You need to know about your recovery. You need to have a thorough plan of action, game plan, covering all your bases, doing all your research on what foods cause swelling, what foods promote healing, on what supplies cause swelling, what supplies support and help the lymphatic system. What is manual lymphatic drainage? What's supposed to be happening in the room? How does the technique work? Why do we swell? What is swelling there for? Like everything from A to Z about the process after the surgery, not the surgery itself. Because you can go and watch a YouTube video and see how the surgery is done. But you're not involved in the surgery, guys. You guys are just on the table. That's it. You're supposed to be involved in your aftercare. You're supposed to be meal prepping. You're supposed to be setting up your massages. You're supposed to be in like recovery mode, but like actively pursuing your recovery. Not just sitting there and being like, oh, well, the swelling will go away. It's fine. I'm just going to lay around and be in pain for 6 weeks. I'll go get some massages and I'll squeeze into this garment and I'll be fine. And then at like 6 months, you're like, yeah, I'm still swollen, dude. I thought this was supposed to get better. Or even at 6 weeks, you're like, yeah, I thought this was supposed to get better. I still feel the same. I didn't do anything to help it get better. I thought it was just supposed to get better on its own. No. This is surgery is surgery is surgery is surgery is surgery. Guys, I say it all the time. It is surgery. It is surgery. It's not minor surgery, even if it's a little bit of lipo. Even if it's less invasive, surgery is surgery is surgery. You get your wisdom teeth pulled. That is minor surgery. You get a tattoo. That is minor surgery. You get a knee replacement. That's major surgery. You get a mole removed. That's minor surgery. The wound healing process and the way you need to take care of it, stitches on the hand with the cut, it's all the same. It's all the same. So the research you need to be doing is how your body heals itself after plastic surgery. And that is our course, because that will give you the framework to start building out your recovery plan. You guys need a recovery plan. I can't say it enough. So everything that you need to know about your plastic surgery recovery is the research from reputable sources. Fibrosis is not a normal part of healing. It's a complication. You need to learn about the complications associated with your surgery and how to avoid them and prepare so your body doesn't develop them. You need to learn about swelling, how to work with it, how to get rid of it. Your massages, what exactly is supposed to be going on in the room, how many do you need, when do you start, when do you end, all that's in the course. And your supplies, that's what you need. And your diet and your garments. That's pretty much it, guys. It's a lot more simple than you make it. The reason you guys make it so complicated is because you're looking at other people's journeys and what they did, and they did a lot of complicated shit. And it's like you're grabbing for pieces of information all over the internet, but you don't have a straight line, a straight source. That's what our course is for. That's your straight line and your source. But guys, that's a 52 minutes of everything you need to know. That's how we do the research to find out all these things. And I have videos on every single one of these topics. So if you guys are getting lipo, BBL, tummy tuck, breast aug, facelift, all these plastic surgeries, just go to our YouTube channel, type in whatever you're researching, whatever you saw on the TikTok or Instagram that you're trying to verify to see like, okay, what the heck is this? How do I deal with this? Go to our YouTube and I have a video on it. I've got over 100 videos at this point. But you will have swelling for 4 to 6 to 8 to maybe longer weeks with all of these surgeries. You can always develop fibrosis and seromas and necrosis. You will need garments with all of these surgeries. You will need lipofoams with all of these surgeries. And you will need manual lymphatic drainage massages with all of these surgeries. That's the rundown. So guys, Ashley with Amare. AmarePostopShop.com for your supplies. You can watch the product videos on each product page to learn how to use your supplies. And the course, our online course, so you guys can enroll in that and get all your research in one straight line and start your plan of action. That is in our post-op shop as well. If you need me, if you need someone to help you put things in a straight line so that you're on a mission and you got a post-op plan and you're ready to go, 732-841-0142. I do virtuals and I do in-person sessions in Highland Park and Elizabeth, New Jersey. 732-841-0142. Number's also in the description box. You could set up a session with me. And that's it, guys. So I hope this was helpful because I really want you guys to start understanding how you need to be going about your recovery. That's really what it is. And that's what you need to start learning, like how to navigate your recovery before surgery, if you can. Sometimes it's after, but if you're finding this video, what you need to know before getting lipo, BBL, tummy tuck, breast aug, and other plastic surgery, it should be before. So I hope this gives you like a good jumping off point to try and get started. That course is a great place to start because it gives you all the essentials as far as your products, like your information about your massages, how your body's going to heal and all of that. And then if you need help still with garments and all of those things, you can set up a virtual with me. But guys, I hope this was helpful. I hope it got you thinking about the ways that you need to start approaching your recovery and not just picking up breadcrumbs of information online and trying to like scramble through your recovery and like figure it out as you go. Guys, we don't have to figure it out as we go. It's all right there. Like it heals the same way as everything else. It's just you guys don't have any of this information in a straight line. So go check out the course. I will see you guys soon. Ashley with Amare. I really hope this was helpful. Bye.